3, 2, 1.
So, good evening and welcome everybody to this another episode of Wednesday Musing. And we'll be continuing from where we left last week because this is really an important topic for all of us, and we are doing an in-depth analysis on this particular topic. So, let's proceed further, and I'll invite Tarang, our convener, to take over the proceedings. Over to you, Tarang.
Yeah, good evening. Hello, everybody. And to sum up our last meet, we discussed a few chapters of the guidelines provided by the MCI or the NMC. So first 5 chapters we discussed in depth in our last meet because there were more kind of technical aspects covered in that. So to sum up the heading of the first 5 chapters, the first one was the code of conduct of the doctors, then the duties of doctors towards the patients. Then another one was the responsibility of doctors towards the consultant, and responsibility of doctors to each other, and then the duty of the doctor towards the public and the paramedical staff. So these headings we discussed in our last meet. Today we are having a more descriptive topic, so we decided to keep a separate meet for it. So today we'll be discussing the unethical acts, the misconducts, and then the punishments because on the basis of these unethical and the misconducts. So Borate sir, let's start.
Sure. Good evening, everyone. The code of conduct and guidelines laid down by the Medical Council relating to unethical acts cover a lot of things relating to the practice of doctors. An important issue that is mentioned here is advertising. Doctors are not allowed to advertise their service in the newspapers or in any public forum. They shall not also allow anyone else to use their name in any manner of advertising. It is also expected that the doctor shall, when any information about him is to be put in the public domain, he should not do it in a manner which tries to, disclose to the public his various achievements and all those things in a manner which may appear to be a self-aggrandizement or publicity. Now, we know that the text of these guidelines is very clear. It also mentions photographs, videos, advertising in any way is discouraged. Now, the only exception that is clearly mentioned is that you are allowed to make public announcements, including placing advertisement in the newspaper about starting of practice, of change of type of practice, or change of address at which you are practicing, or temporary absence from your duty, or notice of resumption of your practice or starting of another practice, or taking over somebody else's practice. And if you wish to declare publicly the charges that are will be levied in your practice. So these are exceptions that are allowed. And other than that, anything else is, at least for the purpose of punishment or judgment, considered as wrong. The other thing also is the council is very clear about how you will have your visiting cards, how you will have in your clinic or in the public, you can display your degrees and so on, but not photographs. You should not have photographs on your visiting cards. You should, in other words, you should be discreet about your whatever you do in the public domain. However, you can put things like diagrams or something relating to your specialty on your visiting cards or in your clinic. Um, that is supposed to be okay. The other thing is patenting and copyright of whatever you have put out or invented or something new that you have done. It is permitted for you to obtain copyright, apply and obtain patents for whatever new things you have done. However, it is specifically mentioned that whatever you may be having, if public good is involved, there is some urgent thing where whatever you have is necessary, then you are not supposed to profit from it. You should make it available to the public. You may not be aware of this, but there are so many great scientists who have not charged the public anything, and all the things that they have uh, developed have been made available to the world without any royalty or any charges. The
So I
famous
had one question
patents
about the
without
advertisement.
taxes.
Sorry to interrupt.
Yeah.
So the wordings of the guidelines say that these kind of publicity is discouraged, or is there any other word used for it? I mean, discourage has so many interpretations. So are they saying advertisement is just discouraged or it is illegal?
See, it is the word used is unethical.
So again, it is not, it is unethical, but what in legal sense?
No,
we
now
mean
it
by-
says that so the physician shall not do it. It says that. So
Mhm.
the physician shall not do it. See, let me be very clear that the entire medical council, even if somebody does something that is not supposed to be done according to these guidelines, no action will be taken unless a specific complaint is lodged and the matter is placed before the state or the national council with evidence relating to the unethical behavior. And if after allowing the doctor to be heard and his side, the council decides that his behavior is wrong, the only thing they can do is to cancel, temporarily suspend his license for a few days or a year or so. Uh, the possibility of suspending the license entirely or permanently is not even mentioned unless there has been an offense which has resulted into something criminal, and
Exactly.
he has been sentenced by the court for murdering someone, for example, or something like that. Other than that,
No, I just wanted to be clear about the legal aspect of these wordings and these guidelines because
yeah, I see that the guidelines use the word, they describe what is unethical, and then they say that the physician shall not do that. So,
again, it's an open interpretation.
agreed. Of course, they go to great lengths to describe what you should not do and in what manner you should not do. For example, if there is a board outside your hospital, you are not supposed to put unnecessary information other than your degree and your specialty. You're not supposed to put your photographs, for example. Or if you are hmm, putting, so now if you're going to have a website, then obviously all these things will not be possible to follow in the exact way in which it is mentioned, simply because the modern technology and the purpose of all this is to give information in the public interest. the doctor can always argue that the information has been provided not for the purpose of advertising. But if I'm a doctor and I'm performing, say, joint replacement, which is a fairly advanced and a fairly complicated or a surgery. So while providing information, if I say that yes, I have performed so many surgeries, and the information goes on to mention what is the infection rate of the hospital, and it also shows photographs of the technical, uh, good practices of the hospital in relation to whatever is being done by the hospital. Like suppose the hospital has navigational equipment. Suppose the hospital or the doctor has equipment which is supposed to do the allow better outcomes for the operation. I do not know whether that would be a breach of ethics. It is, it is important that information is provided in a manner that does not appear to be anything other than only information. Now, for example, in the social media, there is a concept called reviews by people, by the public. Now, that is not even in the domain of the doctor himself. So if a doctor has put up his own website, and through a review process, there are some posts on that which are saying that the doctor is a great guy. Now, could that be his fault? It's not his fault, no.
So, and also there are, because of this not so clear amendment, there are many loopholes which are made use of. For example, we might see a cardiologist sponsoring or promoting a marathon, and he has his hospital's logo and name on the T-shirt. So that is not necessarily is publicity, but he could label it as awareness program for a good healthy heart you need to run. Obviously, you don't need to run a marathon for a good healthy heart, but then people make use of it that way also.
See the various ways in which the potential for improving the awareness of the public to your particular person as a doctor and a specialist, and whatever you are doing is something that has become quite different in the since the advent of social media and since the advent of the internet. And I don't think that the medical council has taken any cognizance or made any specific additions to its present guidelines, although they have amended those guidelines in 2016 and in 2009, 2002, 2009, and 2016. And last that I know of, also in 2019. They have not taken any specific cognizance of any of these things. So I think their approach seems to be that when any complaint is made with the state or the national council, it is left to the councils themselves to look into the matters and take appropriate cognizance of the complaint in the light of what changes have happened in the way society functions in comparison with what it was functioning, say, 20 years ago or 30 years ago. So obviously there are so many changes that have happened which were not available at one time. I mean, if you just give, for example, compare that people who are selling ready-made garments, now the social media and the internet allows you to look at any number of things right sitting at your home, trying it on virtually, and deciding whether you want to buy it or not. So this was not available um, in the past. Now, obviously, this is detrimental to those establishments who do not have a presence or who do not have a mechanism of selling their things in this manner. So there are various ethical conundrums that are in existence, quite apart from the medical profession, as a result of the advancement of the use of social media as a medium for interaction, as a medium for giving and receiving advice, as a medium of providing and receiving service. And we are facing with the pandemic has uh, thrown up these things in a more direct way now, because till about 5 years back, consultation, virtual consultation, all associations everywhere in the world would have said that no, it is not right. A doctor should not give any advice without actually seeing the patient. But now we are in a situation where all associations have to accept the fact that people in remote areas who do not have access to medical advice, people who are poor and who would otherwise be deprived of expert advice, if that advice is given through or using the medium of virtual reality, it is in the public good. So, therefore, societies or associations cannot really say that it is wrong or judge it as unethical. The question of payment of services and how it is to be paid and all that is also so new and so complicated now that I don't think that the associations or the regulatory bodies are in any position to uh, do anything about it, because there needs to be more research, there needs to be more thought, there needs to be more debate, and there needs to be more, committees which will go into all these things and provide recommendations. So this is, I think, definitely a work in progress. So we had stopped at patents and copyrights.
Yeah.
Now, the next thing is, you're not supposed to run a pharmaceutical shop. A doctor can dispense medicines as a part of his practice. He can, if he's running a hospital, provide medicines and charge for them, but he cannot run a pharmacy shop. So most doctors would give the permission to a regular pharmacist to open a pharmacy shop within the premises or close to the hospital, so that the service of for buying drugs and all is available to the public, and they're not inconvenienced because the hospital doesn't sell medicines. There is a pharmacy nearby which sells the medicines that the hospital patients may need. Now, here also there has been a debate and a lot of issues that hospitals should not force patients to solicit that patients should buy from a particular pharmacy. They should be open to medicines being procured by patients from any pharmacy of their choice. And by and large, this is being followed. And but this is what also is an issue that I have come across. Doctors are not supposed to give commissions. They are not supposed to give discounts. They are not supposed to, in any form, um, reward anybody that is instrumental in getting more patients to them. Now, they are supposed to do that, and there's a lot of legal description that they should not be a party to an act of division, transference, assignment, subordination, rebating, splitting, refunding of any fees for medical, surgical, or other treatment. But at another place, it says that a doctor can, if some other doctor is assisting him or helping him in the conduct of his work, can pay him. So it is obvious that there are various ways in which this can be interpreted and used in practice. Um, so um, doctors are not supposed to allow their name to be used in any kind of publicity. But he can see, now it says he Nothing can prohibit payment of salaries by qualified physician to other duly qualified persons rendering medical care under his supervision. So that means he can pay other doctors in for providing some help to him in some form. Doctors are not allowed to provide any secret remedies. That means some medicines or some things which he says is my medicine and does not disclose what it is, but tells the patient that this will make you all right. So this is not allowed. Whatever he prescribes or whatever he gives should be something that is clearly labeled and it is said what it contains. Uh, Doctors should not experiment on their patients. They should respect the human rights of every patient that comes to them for care, and they will not inflict untried remedies or subject patients to any physical or mental trauma uh, in the course of treatment simply because the patient is not in a position to object to such treatment. So this has been in the past. What has been observed has been done to prisoners or prisoners of war or people who are serving sentences for crimes they have committed. And during the treatment of such patients, these things have happened in the past. Doctors are not supposed to legally um, practice euthanasia, that is mercy killing. Mercy killing in any form or aiding and abetment by a doctor for mercy killing is considered as unethical conduct. However, when there is a decision uh, to withdraw supporting devices like ventilation after the patient is brain dead can be decided only by a team of doctors and not merely a treating physician alone. A team of doctors shall uh, declare or announce that their support for withdrawal of the ventilation subsystem and so on. So there is a procedure laid out of how withdrawal of treatment, uh, either because the doctors feel it is in the interest of the patient or the patient's relatives feel that it is in the interest or they want it to happen. There is a procedure laid out. Now, all these rules which are relating to behavior of doctors do not apply to doctors associations. Okay, so this was amended. The relationship with pharma was amended in 2009, and omission of doctors associations happened in 2016. So doctors are not supposed to receive any gifts more than 1,000 rupees. So if anybody receives a gift, then there is a standard policy of a gift that is between 1 to 5,000 rupees will only result in a official letter of censure from the State Council. A gift between 5 to 10,000 will result in removal from register for 3 months, and a gift up to 50,000 removal for 6 months, and a gift up to 1 lakh removal for 1 year, and gifts more than 1 lakh, the council can remove for more than 1 year. Now, it is not clear to me how the council would know that such a gift has been given and received, unless some complaint has been made, and that complaint also will have to be verified and endorsed by whoever is making the complaint. If somebody just says, "I heard that somebody was paid so much," and there is no endorsement or no confirmation from either the doctor or the party that is supposed to have given the gift, I don't see how this can be enforced. Now, payment for a doctor's travel to attend a conference or a cruise or a holiday or to, pay for a vacation of a doctor and his family by a pharma company or somebody who has a vested interest in promoting something to the doctor is uh, not allowed. But uh, if the doctor himself is going to attend or read a paper at some conference and he is accepting, it is allowed. So monetary grants are not allowed unless it is part of a research and it is something that is officially taken up by the doctor or the institute where he works for. There are quite specific uh, guidelines given for research. So doctors are allowed to work with pharma companies in doing research on medicines that are in the interest of healthcare and medicine. But there are quite elaborate guidelines on what he should do and how he should do it and what he should not do and so on. So all those things that are part of the guidelines for doing research, they are called as good clinical practices by the Drug Controller of India. So all the guidelines mentioned in good clinical practices are the same, are repeated here as to what doctors should be following when they are engaging in research. They should not endorse in any way uh, products or proprietary drugs by any company under the guise of having researched them. They can publish papers relating to the research, and those papers, if they're published, can be quoted by the companies to the doctors in some format. The punishments for all this is usually the same, that for the first time they'll only censure you, and then your name could be removed um, for various varying periods up to a year or more, depending on what has been proved in terms of unethical behavior against the doctor. It is important that the doctor should not compromise his own autonomy or freedom from writing or practicing or using whatever drugs he wants under the specific uh, pressure or uh, persuasion by any pharma company. So doctors are also not supposed to endorse any particular medicine in any written or in any format, which can be used by the company for publicity to other doctors. Um, Now we all know that all these things are in the guidelines. We also know that doctors who are engaged in practice at various levels, whether it is the family practitioner or whether it is a consultant or whether it is the consultant in his own private practice or working in the hospital, there is a constant interaction between the doctor and the medical profession. And there is always a potential for the misuse of these provisions by the pharma company to try and get the doctors to somehow do or undertake actions which will result in more of their drugs getting sold. At the same time, there is also a constant pressure on the doctors to oblige the pharma companies in some way or the other to be appear to be cooperative and friendly. And this is especially true of doctors who are in training or doctors who are young or not in practice for a long time. because of the lack of knowledge of these guidelines and the lack of knowledge that what kind of standards are expected, and also to the lack of knowledge of the benefits of sticking to uh, standard remedies or lines of treatment that are published in the standard textbooks, and not um, try any remedies that are still not uh, widely known and proven. But you know that this is a constant thing that we see happening, and by and large, one does see that the doctors and the medical profession is trying their best to ensure that they practice good medicine. We have in India had two problems in this regard. One is the problem of what are known as generic drugs as compared to the same drug when it is sold under some commercial name, and whether it is uh, correct or appropriate to use the commercial name drugs and prescribe them, as opposed to always recommending and insisting on using the drugs in their genetic form, which will reduce the cost to the patient. So this is one issue that has been under a lot of debate. And the other issue, of course, is the use of combinations of medicines as opposed to single drug remedies, because most of the pharmaceutical recommendations in standard textbooks of pharmacology and uh, drug dispensing are not in favor of using drug combinations simply because of the potential for um, side effects being of both drugs being unpredictable and resulting in problems that should not be there. So there are a lot of formulations available for various uses by the pharma industry, which are approved or allowed by the government. And at the same time, the official literature and books are not in favor of using combination. So the use of combinations or not, and the use of generic or non-generic are two issues that, in my opinion, are still not clearly. There is no clear guideline from the medical council or state councils or the associations on this regard. So by and large, it is left to the doctors to use their discretion or their uh, mm, decision, how much or how strictly they will follow whatever is expected. Now, what happens if a doctor does something wrong? So when a doctor does something wrong, it is called as misconduct. Okay. Now, misconduct may be something that he did deliberately, or something that he did, or something happened because he forgot to do something, or he did not do something properly. So this covers many things which we normally would not associate or uh, consider as misconduct on the part of the doctor. But for example, a doctor is supposed to maintain the medical records. And if he does not or has not maintained records, and this becomes apparent when a complaint is made and investigated, then this could be construed by the regulatory authorities like the councils as misconduct. If a doctor does not display his registration number um, wherever it is required on his prescriptions or certificates or whatever, then it is can be construed as misconduct. Adultery or improper conduct with patients and employees who are under your employed by you is also considered and liable for. If a doctor is convicted uh, by any court for any criminal offense or morally wrong act, that also can result in action by the state councils, either of suspension of license or of complete removal of license. Doctors are not supposed to do sex determination tests specifically for determining the sex of the female fetus, leading to feticide and so on. And there are various acts and laws prohibit, and action is recently we have seen in the last few years that uh, certain types of doctors like radiologists and people who do ultrasonography have been investigated and uh, convicted or charged with offenses in this regard. Then whenever you give certificate, you should not give wrong certificates. You should not give certificates which will result in benefit to somebody by certifying wrong things. Now in the orthopedic profession, I don't know if you are aware of this, but there is some income tax benefit for somebody when they have disability of more than some 60% or something. They have specific provision in the income tax rules, and the percentage of this deformity is clearly mentioned and clearly described and defined and all that in that. Now, if a doctor, knowing that and knowing all the rules and knowing that the patient has a percentage of disability which is less or does not qualify for that income tax concession, chooses to give, and in that process mention some things which are not actually the case. And if the matter is investigated by the income tax department and found that the doctor has given wrong, incorrect reasons for that, that could be an example of wrongful certification. I don't know how far this happens, but it should not, and it is clearly provided for in these guidelines that it should not happen. Doctors should also be mindful of what are the acts relating to drugs and cosmetics. So they should be very careful while prescribing steroids, psychiatric drugs, where there is no proper or absolute indication, and particularly providing Schedule H and L drugs, poisons, to the public except to his patient and in very, very specific conditions. So another thing that is mentioned here is doctors are not supposed to allow or enable somebody who is unqualified to perform anything like an abortion or any operation under his supervision, um, because it is wrong. He is not supposed to do it. He should not issue certificates to any medicines or any non-medical, uh, any person who has no qualification in modern medicine. He should not give him certificate saying that this guy is good in taking care of patients and he has got experience in doing whatever the doctor or the hospital is supposed to be doing, because you can train people, you can teach them how to do things, but you are not supposed to certify that they are competent to do A or B or C things without supervision and so on. So the law or the guidelines do not prohibit you from training or teaching people who are unqualified, because there is a lack of qualified people all over the country. But they can work under your supervision or anybody else's supervision, but you should not certify that they are competent to do things independent. So there is a line between these two things. Are doctors allowed to write articles in the press and in the newspapers and in the Maxis. Yes, they are allowed, provided the intention is not to publicize himself or something that he is doing, which is basically not considered standard information in the public domain. So he should not be writing uh, to gain publicity, and he should make sure that confidentiality and other things are properly maintained when he is publishing anything. He is allowed to give public lectures, he is allowed to talk to the radio, TV, internet, etc. But with the same proviso that I just mentioned. Now, can the doctor, the institution advertise? Yes, the institution can advertise, but the advertisement should not contain anything more than the name of the institution, the type of patients admitted, type of training and other facilities offered, and the fees that are charged by the institution. But as I told you, this is something that is completely difficult to define when you are developing a website which allows you to give a large amount of information and keep it where people have access to that information. So within the spirit of what is said here, people can develop websites and do these things. They should not have very large boards outside hospitals or their clinics. Their consult prescription papers also should be very discreet, and so on. They should not disclose secrets of a patient during any uh, uh, thing that requires them to speak in a court of law, for example, in circumstances where there is a serious risk to a person or community and notifiable diseases and so on. So, in case there is a patient has some illness that needs to be notified to authorities in the interest of public health, then the doctor should do it. There is no question of confidentiality there. They should not refuse treatment to anybody on religious grounds, um, but especially in issues of sterility, birth control, circumcision, medical termination, etc., unless that he is incompetent to perform that. So any doctor treating any patient can and has the freedom to decline to treat the patient under the provision that he doesn't know how to do it. He's not competent to do it. So that provision is always applicable to all physicians. Of course, he should take proper consent. In case of minors, he should take consent of the parents, and he should make sure that that consent has been properly recorded and signed by the people who are supposed to sign. Um, Publishing photographs, case reports of patients without their permission is unethical. Um, in case you're running a hospital or nursing home and you're employing other people, whether it's nurses, whether it's assistants, or whether it's technicians, the ultimate responsibility of the care, and if anything goes wrong, rests with the doctor. He cannot say that, something happened which was not my fault, which was an error by one of my staff, and so I can't be held liable. So that doesn't. He has to. He is expected to assume overall responsibility as the owner or the head of that clinic. He should. He's prohibited from using touts or agents to get patients. He should not use specialists who are not duly qualified, but who are posing as specialists. he should obtain proper and informed consent for in vitro fertilization or artificial insemination. And while doing research, he must know what are the ICMR guidelines and the GCP guidelines and follow them to the best of his ability. Now, what are the punishments that can be given by the councils?
Yes, sir.
So-
Before we proceed,
Yeah.
I'll just sum up a few points, important points about the unethical acts, the chapter 6 and the misconduct of chapter 7. So under unethical acts, sir spoke very exhaustively about the advertisement and notifying any change in the address or any upgradation in the facilities of the institution can be allowed. But then publicity of a particular individual doctor is not accepted, or rather as unethical as per the MCI. Then some treatment pattern or form should not be patented. It should be kept unpatented for the benefit of the society. And a doctor himself can't run a pharmacy or open a medical store. Then there should not be any secret remedies. And a doctor should not practice euthanasia. And then a doctor should not accept commissions and in form of travel or maybe cash, even if it's a cash, very limited amount. And even if a doctor is doing a medical research on some medicine, it should be a non-funded one and not a funded one by the medical by the pharmaceutical company. So that was about the major points about the unethical acts. Now coming to the misconduct. Misconduct is first very important part is the medical record. Doctor needs to present the medical records whenever needed within 72 hours in the case of court of law. And he has to display his registered number. He should not indulge in acts as like adultery or should not abuse the patients. He should not indulge in taking illegal tests like sex determination tests, etc. He should not appoint unqualified people or person in to do a certain job in his institution. And though he is allowed to write article, the intention should not be his personal publicity. So, and he should not disclose secrets of the patients to anyone else. And he should not, most important, very important, he should not refuse to treat on the religious grounds. Proper informed consent is very important whenever a procedure is to be done. And he shouldn't be doing publishing photographs of the patients without their permission. And even if there is any research going on, it should be under the guidelines of the ICMR provided. So this was about the chapter 6 and 7, the unethical acts and the misconduct. Now, punishments. If you do not follow or abide by the above chapters, certainly there are going to be punishments. And sir will speak about that now.
Yeah, I'd just like to just say one thing about the publishing things in newspapers and the lay press, In the last few years, what I have noticed is that there is a very, very unhealthy practice that is happening from the side of the press and the newspapers and the media of actually taking money from doctors, allowing them or projecting them in the newspapers through various mechanisms and putting out whatever information that they want, which will actually lead to projection of their own selves and their institutions in the public domain, So this is happening it's happening more and more. And it is somehow, there is no, there is a lot of pressure for the media and the news to get more revenue in whatever way they can. That is one reason why this is happening. And the second is that there is a need by medical professions and institutions because of the increasing competition and the increasing use of these avenues by other someone or the other. So it's become like more and more, and it's become more and more happening more often and more openly than it used to happen in the past. So this is something that is a changing trend in society itself. It's not in the medical profession per se, but all professions are being approached and told that if they are willing to sponsor, they're willing to pay for it. There are various ways in which they can be provided what to them is publicity. So this is happening, and this is something that we need to debate a little more because the medical profession is also being involved more and more into these things. Now, coming to punishment, um, first of all, the concept is that uh, this code of conduct does not list all the offenses. So, whatever the offense that may not be covered by this, but which is considered wrong by the criminal procedure code, is also applicable to the medical profession. So, even if it is not specifically mentioned in letter, uh, the code should not be violated even in spirit by all doctors. No punishment is will result unless a complaint is made by somebody. Normally, complaints are supposed to be made to the state council, and information about the state council is usually available with the local medical councils that exist uh, in a city like the Indian Medical Association or some other uh, associations. Now, if and when a complaint is made to a state medical council, they are supposed to hold an inquiry. They're supposed to give opportunity to the doctor to present his side, either in person or through a lawyer. And if he is found guilty or liable, then there would be some kind of a uh, disciplinary action, including suspension. And if such a thing has happened, the council is supposed to tell the public that this happened. Unfortunately, this doesn't happen as openly or as frequently as it should. But this is what is the intention, that the public should be made aware if some doctor is found liable for something that he has or she has done, and which leads to a temporary suspension or permanent suspension. Um, Again, this removal from the register and then restoration and so on also has to be done through proper procedure. Um, it is expected that all complaints should be attended to and dealt with within 6 months. And it may, during the period that the complaint is pending, uh, they may temporarily restrain the doctor from doing something that is under scrutiny. Professional incompetence, how it should be judged, is also defined. Normally, professional incompetence is judged by peers, not by anybody. So, normally, the state council, if there is a complaint against an orthopedic specialist, they would appoint a certain number of peer group who will be asked to judge or pass judgment on the viability of the complaint and such. Now, if for some reason the state council is not doing its job properly or is not following these guidelines, anybody can take the matter to the medical council, the national council, or if their complaint has been not upheld by the state council, and they can appeal to the national council. So this is again required. The national council is supposed to make sure that the state councils are doing their job properly and they are attending to all the complaints in expeditiously, and also taking them to task if they're not doing so, and hearing all appeals and hearing all complaints that have resulted from lack of action or delay in action by the state. And these are things that are covered under punishment. I would just like to mention here that while we are talking about the medical council, in India, there is a consumers forum and a mechanism of local state council and district council, state council, and national councils, which are supposed to hear complaints against doctors, because doctors have been covered by the Consumer Protection Act, and that has led to a lot of complaints against doctors outside the purview of the state councils. So that is an area that we have to face because of the medical profession having been brought under the Consumer Protection Act and so on. So this in short covers the three areas of unethical conduct, misconduct, and punishment.
So, and anyone can file a complaint. And I mean, if you are advertising and if it doesn't fit under the norm, not just a doctor, but anyone can file a complaint. And it can lead to permanent or temporary suspension. So excellent overview, sir. And
what I am concerned with, and I would like to mention here, is that the medical councils, whether at the state or the national level, they do not enjoy the respect and stature that they should in the eyes of the public over the last many years, because I have heard this from many members of the public, and I tend to agree with them, that, the councils are supposed to be regulators. When has any council suo moto done a survey of how clinics are putting out their boards and send letters to all the concerned establishments which are found to be not doing what is supposed to have done or exceeding the guidelines, and keep record of that and tell that to the public that yes, we are doing something like that. We are doing it periodically. Is this happening actually? Not happening. Or are doctors or associations taking cognizance of complaints being made? For example, a doctor had made a complaint in some medical council in Andhra Pradesh or Karnataka or somewhere about the internet and the hospitals holding video programs and so on, and promoting their own doctors at the cost of other doctors who are following council guidelines and therefore not getting promoted. So the state council had issued notices and actually fined the concerned corporate hospitals, and that has led to a lot of discontent amongst the doctors and a debate amongst the medical professionals as to whether this should be more allowed by everybody rather than not being allowed for anybody. So what should be done? So this is something that is still out in the open. But today, the state councils as well as the national councils are not perceived by the public as doing anything to discipline doctors or take action against doctors who are there is no evidence, there is no visibility, there is nothing happening. And the idea or hiding behind the thing that we will act when there is a complaint. knowing fully well that the public is not even aware of your guidelines. The public is not even aware how to make a complaint. And the public would be least interested in making a complaint if they know that at the end of a long and tortuous process, nothing significant is going to happen other than a temporary suspension for 3 or 6 months or whatever it is. So, by and large, the any profession, particularly like the press or the medical profession, which are held in high esteem, are supposed to be self-regulated. The public expects that doctors will behave properly, and there should be internal mechanisms which they themselves will keep, uh, strict and strong and healthy to ensure that the public feels this, they are behaving properly, and they have an internal mechanism which ensures that such things do not. Yeah.
Right. Yeah, so they have to be regulatory. The regulating focus more on regulatory powers. So, sir, do you have any idea about the medical record of how many years back is applicable? Because if you are being practicing for 20 years, is it compulsory or mandatory to have a record of all the 20 years patients, or is there a limit?
Good question, because I'm just now going to attend on the 7th of this month the court call of a patient that I am supposed to have seen in 2011. Okay, that is almost 10 years ago. And the hospital at that time where I'm supposed to see the patient did not belong to me. I was only a visiting consultant there. And the patient appears to be an outpatient. That means they have said that you bring the register relating to the person who came with an accident and was treated on that day. So it so happens that the hospital has been closed in 2014. The hospital doesn't exist. And so I have obtained a letter from the hospital saying that I was not, I was only a visiting consultant to that hospital, and that I have requested them for more information relating to this particular matter. And they are saying that they do not have any records that will help in the matter. So I will present this to the court, because legally, the rule says 7 years. Okay.
Right.
So now, if this case was filed in, say, 2011, the hearing is in 2021. So technically, I was not made aware of this till 2021 when I got this summons. So the case may have been in existence, but I was not aware of it. Neither was the hospital. So it is not likely that the court will hold anybody liable. I would only suggest one thing to anybody who is interested, is that they should make a distinction between medical legal cases and ordinary cases of accident. Now, medical legal cases, you should digitalize all information and hold on to it in the interest of justice, because the law and the time is not relevant. Because you know that justice is delayed, and you know that things may occur at a long time. If you're working at another hospital, like I was working at Sassoon Hospital, and I am retired from there in 2010, and so some matter comes up, it is the hospital who maintains the records and not the doctor. So the hospital is continuous and they will follow the matter and so on. But if you are a private practitioner and you are treating patients who have been registered as medical legal cases, I would say that till such time as you are in a position to go and attend the courts, you can at some point declare that you are retired and tell the court that you are not in a position to attend. And you are willing to provide the records for the court through somebody whom the court appoints.
Right.
So there is a mechanism by which a court commissioner can come to your residence and you can show them whatever records you have, and based on that, they can a hearing. You can said to have participated in the hearing. So that I would say for medical legal. Now there is a second and a much larger number of cases which are known as accident liability cases. So almost everybody who got injured on the road is covered by some kind of an insurance or the other. And he goes to a lawyer and the lawyer then files a case and so on. And if you have treated him as not treated him as a medical legal case. And subsequently a case does happen. And it could happen to many patients who you treat as trauma. So there is a problem with those cases. And so after 7 years, you are supposed to not keep records. But I always say that in case you are going to destroy records, you should follow proper procedure of giving a public advertisement saying that records in that hospital pertaining to this and this period are being destroyed, and any patient will be destroyed. And 15 days time is given to all patients and any other interested parties to approach the hospital for obtaining a copy or the originals if they wish to do so. At the end of this period, the records will be destroyed and there will be no liability on part of the hospital for it. So this advertisement and this period and all this record has to be maintained by you, even though you might be a small establishment, because the law doesn't distinguish between small and large, institutions or so on. So as a doctor, if you say that I didn't do anything, I don't have any records, it is not it will not be construed as being helpful to the court. But if the time has lapsed and therefore you do not have records, but you should have a proper sequence of which you can provide support when you say that I don't have the records. Now, the younger generation in our country is not as conscientious as I am. So, like say income tax, everybody says after 7 years you can destroy records. So who the hell cares? Why the hell should you bother? You can just tell the income tax to go and buy a kite. Don't ask me anything about what happened. Like we are in 2021. What happened in 2014? Because you can just put up your hand and say, I don't have any records. Whatever you have, you can take any decision based on that. But don't ask me. But by and large, in this country where we treat the authorities with fear for the potential trouble they can cause to us, it is always good practice to hold on to whatever you have in a format that is possible to maintain without too much difficulty.
Digital.
So I'm of the opinion that we should be helpful to the authorities. We should be like, imagine the other way around. If as a human being you met an accident and you are stuck in a case where you are expecting some compensation to be awarded by a court, and you find that everybody involved in that other than you is least bothered about it, so you will not feel very good. So,
absolutely.
Yeah.
So 7 years by law, for law, 7 years is the limit, after which the hospital or the doctor is not liable to keep maintaining records.
Except in medical legal cases, where he has to keep it permanently.
Medical legal cases, he has to keep it permanently. And also, like you mentioned, a very nice word for justice, because when you are treating the patient, it is very important if you treat him holistically and your medical, just keeping some medical record, some document helps him out in his long-standing court case.
See, I will tell you my experience in this. You see, I have helped the courts in many cases. So what I have realized is, what the court is really interested in the doctor helping them is to determine whether the injury was grievous or not. Okay, because that alters the approach to compensation. Because the compensation is like one thing for minor injuries and another for grievous injuries. That is one thing. Because it is not the doctor's job to help the court in finding out whether the person who made the accident was guilty or not. That is not our problem. That is between the police and the courts to determine. The court only wants to know from us that whatever is being claimed by the whoever has filed the case,
The appellant, yeah,
is correct or not in medical terms. So if that person has listed 5 things and he says that, look, all this means that I've got a grievous injury, the treating doctor is the best one to tell the court, yeah, these are 5 things, but 1 is not grievous, 2 is, 3 is not, whatever it is. So the courts take the word of the doctor as final. There is no debate about it. Now, naturally, if the lawyer who is opposing the others, or who is representing, say, the insurance company that would want the compensation to come down, can ask the doctor as to why he thinks, oh, this is this and not that and whatever. So there is a certain element of argument that may happen in your trying to help the court regarding determining the severity and extent of injury. That is really the only thing that the doctor is supposed to. I'm talking now only of orthopedic surgeons. The other thing that doctors are usually not aware of is the fact that the the courts also uh, expect the doctors to confirm certificates. You see, because the court has no way of confirming certificates otherwise. So if you are given a certificate saying the injury is this, then the court will accept it. And when somebody comes and says, yes, this certificate was issued by me and this certificate is correct. It is, see, because the other side alleges that this is a bogus certificate. They say this certificate is not given by the doctor. He said, fellow has just produced something. And how is the court to decide? So that is why court requires the doctors to authenticate all documentation that has been submitted by bringing the originals and looking at the document and saying, yes, ये जो कागज है, ये मेरे पास जो कागज है, उसमें वही है जो इसमें है. तो ये एक legal issue है that whatever has been submitted is not the original. So the court needs to confirm because the original is held by the hospital. So the court always says, okay, help us to confirm. And we take it as court is troubling us, court is making us appear. The court actually doesn't need the doctor as an expert. They need him to come with the originals. And it's that simple. कि जो जेरोक्स सबमिट किया है, जो फोटोकॉपी है, वो करेक्ट है, मेरे ओरिजिनल के मुताबिक है, इसमें कुछ हेराफेरी नहीं. इतना हमको बताना पड़ता है under oath. Once that is done, and of course, the opposition lawyer may ask to see the original also. मैंने आज तक जितनी बार मैं कोर्ट में गया हूँ, nowhere has anybody asked me to show it. Never. They respect you. You are just seeing holding a case paper. They'll not ask you कि मेरे को दिखाओ इधर क्या लिखा है. They just assume that whatever is produced is correct, unless there is a huge issue or something. But it has never happened to me in 35, 40 years. So that's not an issue. So most of the time we are asked to only confirm कि Xerox है वो सही है कि नहीं. And secondly, जो injury है वो ये जो कह रहा है वो grievous है क्या नहीं, वो भी उधर लिखा रहता है. But since you are there, they ask you. And they say तुम पेपर पढ़ के हमको confirm करो कि ये जो लिखा है fractured femur है, तो fractured femur एक grievous injury है क्या? इतना ही वो लोग they will ask. Other than that, and by and large, courts are very, they treat doctors well. But unfortunately, it is wasted. The compensation or the transport allowances are very meager. And that is why doctors in private practice particularly hate the whole legal process and avoid doing it as far as possible or avoid getting involved. And till such time as our justice process becomes more user friendly and faster and reduces the waiting time and makes, like for example, all records submitted by the in a particular case, why can't the court just send a copy to the hospital or the doctor and say, "Ki you verify that this is correct"? Why does he physically have to be there? Why can't he just do it via video conferencing, where the judge need not be, but some officer of the clerk of the court goes page by page and he says page number 8, either either whatever, so that this becomes easier for all concerned. But
Yeah,
I don't.
We have a second, I mean, if we have the third wave around, definitely this will be implemented as well. We are having no other option. Yeah.
No, I'm just saying that, we have the medical profession, on the one hand, which is not proactive in recommending to the courts and to the legal system which professional body the IMA or Indian Orthopaedic Association has taken this issue, appointed a committee, and made some recommendations to the courts or the Chief Justice of India. Because it is within the power of the courts to do it. Because ये सब court procedures है ना. लेकिन हम जब तक proactive नहीं होंगे, we don't do it ourselves. We just expect that the judges will someday decide to do it. Why should they? We have to also push things from our side. Which means that we want to help the courts. We want to ensure justice is done to all patients. And we want it to happen without unnecessary harassment and time wasting by the medical profession. So if there are some simple mechanisms which can help us and the courts, and it's a win-win for everybody, who will do it? Should it not be the professional association? So I always keep saying this, and Dr. Ashok Shyam always starts smiling, because when I say that the Indian Orthopaedic Association has so many things that they can do, which are necessary and not really political. They are things that are improving and protecting the interest of their members and making things more efficient and see, we always say that when I go to a Western country, everything is very good. There is so much of cleanliness. People don't shout. Everybody is very polite. In the same way, their legal justice systems are also very fast. Now, all this requires us not only as citizens to be proactive, but also as professionals to be proactive. We can't expect that improvement will happen out of thin air. It cannot happen. We have to constantly look at what are the things that I can do as an individual, as a member of the public, and as a professional. And when I come to the issue of professionals, this is one of the reasons why we are having these musings, is because we are trying to look at those areas of practice and professional actions and professional duties which are normally not in the spotlight, and look at them and suggest to ourselves to begin with what can be done. And then if we feel that it is necessary to bring this to the attention of our associations or our representatives, to do so. Right?
Absolutely. So yeah, excellent first-hand experiences because of your vast experience in the medical field. And So that helps us to understand things better. And like sir said, very important point to note here, that the court wants us to just certify or guarantee the grievance of the injury. The court doesn't intend to harm or cause any problems to the doctor. And yes, hopefully, when the regulatory bodies realize, there will be more amendments in the MCI, more amendments to be seen, or NMC, in the guidelines of the NMC. So all in all, it is the end of the second part of the guidelines by NMC or MCI.
See, one thing I'd like to mention here, which just occurred to me, is that many doctors and most of the public who drive vehicles are not aware of this. That's why I'm mentioning this. That is, that suppose I take a stick in my hand and I hit you on the head and you get a fracture, then everybody will agree that I have committed an act of violence which needs to be punished if that has resulted in harm to you, because I've taken a stick and hit you with it. But when I'm driving a vehicle and through no fault of mine, when I'm following the law, I'm not doing anything wrong, you come and hit me with that vehicle and I sustain a fracture. For legal purposes, it is the same. It is not any different. It is not that, I mean, it is constituted, I took the car and I hit you with it. You understand? That is how the legal process looks at this thing. Whereas we tend to think that I made an accident. I accidentally injured somebody. So it's like an accident. It's not intentional. But the court calls you as a criminal. Anybody who is involved even in breaking the traffic light, when he appears in the court, he is called as ROP. He is not called as Mr. So-and-so, who he is called ROP. He is somebody who is a perpetrator of a criminal act. This most of the public do not know, or even if they go through that procedure or that process, they come out thinking it is a small thing and it was accident, it was unintentional, it was forgetfulness, I forgot to renew my license, whatever it is. But they don't realize that for the purpose of the law, whether you hit somebody with a stick or you hit somebody with your car, is the same thing, because you are supposed to use your car with caution and not intentionally or intentionally injure people when you are using the car, especially in the public domain.
Right.
Yeah.
So, yeah, the road traffic is so interlinked with not just one aspect, with the traffic, with the driver, and if there is any accident with the victim as well. It could be anyone's fault. And a very valid point mentioned that he's treated like a criminal, or he's addressed as a criminal.
No, and also there is this common thing that most people have this belief that the pedestrian or the person who is injured is at fault. But what the law says is that even if he is at fault, even if he should not have been on the road when he was, your duty as a citizen when driving a vehicle which is driving at a speed is to have the means to stop it and injure somebody who comes in your way. Just because somebody comes in your way, you cannot say that he should not have been there.
And you just dash him away.
Yeah.
Yeah, because you
now, so you may then argue, and it may happen, and it does happen oftentimes, that in the process of driving a vehicle, somebody comes in your path suddenly and in such a manner that there is too little time for you to take preventive action. That can happen, and that does happen. But by and large, most drivers should be aware that it is their job not to injure people. It is not the people's job to protect themselves against drivers. So even if a citizen comes in the way of a moving vehicle, it is the job of the moving vehicle to prevent an accident or prevent it. It is his job. So if he doesn't do his job properly, prima facie, he is by definition considered as the guilty party. So if somebody is driving a truck or a vehicle that moves at certain speed and he injures another vehicle that is not capable of driving at that speed, prima facie, the vehicle that has more speed is guilty. So if a car driver injures a two-wheeler, the car is at fault. If a two-wheeler injures a cyclist, the two-wheeler is at fault. If a cyclist knocks down a walking pedestrian, the pedestrian is not at fault. That is because the cyclist is supposed to be able to control his vehicle. He is supposed to avoid hitting somebody. And that is his duty when he undertakes to drive. That is, this is my observation, because most members of the public, including the medical professionals, do not seem to understand and accept this. When they are in a situation or somebody close to them in a situation, they are not aware of this, and they tend to generally think in terms of who is right and who is wrong. So this is all predetermined prima facie. There could be exceptions to it, but that's the way it is.
So, like with a bigger vehicle comes bigger responsibility.
Exactly.
Yeah.
Bigger and faster also.
Faster, yeah. Yeah, and we did a workshop or a kind of a seminar on Indian Orthopaedic Day, Maharashtra Orthopaedic Day in my town, and the theme was based on awareness of RTA. And I was surprised to go through the speed limits which have been actually set as a guideline. And 95% of the traffic on the road do not follow that speed limit. And like you said, if that speed limit is followed, it will definitely be not a big job to brake immediately and avoid a collision.
Yes.
Yeah.
That is true.
Yeah.
And also, the problem that I see in behavior on the roads is that there are, just like I told you, that vehicle with bigger size and higher speed is supposed to be more careful. In the same way, there are rules of the road which also determine that somebody who is driving on the wrong side is at fault. You're not supposed to do it. So if you're driving on the wrong side and you meet with an accident, you cannot then say that, so what if I was driving on the wrong side? The other person was driving a vehicle which was at a higher speed, so he or she should have avoided me. Prima facie, you should not have driven on the wrong side. The other thing, of course, is that there are exceptions. Like if you're driving a police car, you're supposed to, drive fast, and you're justified if an accident occurs because you are in the process of trying to do something to implement or to withhold the law. Same an ambulance, when it's transporting a accident victim whose life is in danger, has to drive fast, and they have to, they are allowed to certain leeways, which may result in some untoward incidents. But then they are officially exempted in those situations. But an ambulance which is not carrying any patient cannot put on the siren and drive at breakneck speed because the law permits it. If it is found that they met with an accident, there was nobody in the ambulance, they were not transporting anybody, they will be dealt with as quickly as somebody who was driving on the wrong side.
Right. Yeah. So again, for our viewers, that's the good part of our meetings, from medical legal laws and giving examples, sir, first-hand examples of medical legal court calls. We discussed on driving as well. That is only and only because of sir's vast experience. So here we would like to end our second and the final part of Code of Ethics conducted by the MCI and the NMC. Hope it turns out to be very much helpful for our younger practitioners. It is very much helpful for me. Many points have been cleared up, and I'm going to imply them as soon as possible in my practice.
Thank you.
Thank you. Yeah.